The Shift is brought to you by SE Healthcare. Welcome to The Shift. I'm Dr. Andrea Coyle. Hey, welcome back. This is your host, Dr. Andrea Coyle, Chief Clinical and Innovation Officer here at SE Healthcare. As you know, the Shift podcast was really created with you in mind, with nurses in mind, with friends of nurses in mind. And each week we interview people that are influential in this space, people that have energy, people who are making the shift. And as a reminder, a shift can be a shift in tendency, frequency, direction, location. Sometimes you can shift your mindset. Sometimes you can shift your position on something. You can shift your intellectual, your physical, your spiritual location in your mind. So that's why we created this podcast. And today, I am so thrilled to meet a friend and colleague and a highly influential nurse practitioner coming to us from UPenn, Dr. Nicole Parone. I'm going to kick it over to you. I'd love for you to introduce yourself to all the shifties. Welcome.
Hi, well, thanks for having me. I'm Dr. Nicole Parone. I started out as a nurse in the NICU and labor and delivery, did a little bit of research for the NIH in maternal fetal medicine, and eventually decided that I wanted to become a nurse practitioner. I loved women's health and I just wanted to learn more about it. So, throughout my career, I've always been educating myself, re-educating myself, taking advantage of those opportunities. And so while I was a nurse, I went back to school the slow and painful way, as many of us do, taking one class at a time, and eventually became a women's health nurse practitioner, and really just loved, for me, that shift of, I loved bedside nursing, but I also, as I became an NP, really enjoyed that kind of detective work you do as a nurse practitioner as each patient comes in, figuring out what's going on, really digging in. And I just loved that, you can have two patients with the same problem and end up coming with a coming up with a totally different treatment plan based on that patient. I think that's one of the things that nurse practitioners are really good at, is taking that, the whole patient into account. So became a nurse practitioner, worked in a private practice, very busy private practice for about 10 years. Then came over to Penn, where I went to school to become an NP. I landed here, worked in a practice, OBGYN practice there for about another 10 years. And then 2 years ago, I had the opportunity, as I was going back to school for my doctoral degree, I was about midway through that, became really interested in leadership, and something opened up at Penn that allowed me to still utilize my NP skills and see patients, but also utilize that leadership angle. So now I am the clinical manager in a gynecology shared services space, which means that here in our outpatient setting, we do urogynecology, family planning and abortion services, gynecologic oncology, infertility, minimally invasive surgery and gynecology. So it's really all things women's health except OB. So managing that, and then also seeing patients, which I really love. When I went back to school for my doctoral program, again, became really interested in leadership. When I started to go back, I didn't know what I was going to do with the degree. I just, again, wanted to attain that terminal degree in a profession that I loved. And I love learning. So I was like, I don't know what I'll do with this, but, we'll see where it leads me. And it led me here to a great, a job that's a great experience, and again, allows me to utilize just, not only those nurse practitioner skills, but also leadership, which is, this is what I love about nursing. There's so many different things you can do and so many unexpected places that it can take you.
I like what you said. And just to go back to the shift, there's so many shifts that a nursing career can do. And I have to tell all the shifties listening, when I met Nicole, she started to tell me about her DNP work, her aspirations in leadership. And I'm a firm believer that every nurse is a leader. Nurses that are in the clinical care delivery environment. They are leading the care of the patient. I mean, really, your nurses are in charge of everything. We are leaders at every aspect of nursing. And I really was honored and privileged to read Dr. Nicole Parone's DNP work. And a lot of it's focused on joy in the workplace, burnout. I'm thinking Dr. Perone, I'm not sure. By
Still
the way,
sounds strange to me.
I know, and I have my DMP in nurse executive leadership and innovation, and I think sometimes we nurses that have our PhDs, our DMPs, are reluctant to say we're doctors, but guess what? We did it the slow and painful way,
Yeah.
just like you said. It's a lot of work. So I love to prop you up that you're a doctor, but moving forward, I'm going to call you Nicole for the shifters. And P.S. Nicole's middle name is Andrea. So, this was kind of meant to be.
It's fate.
Exactly. So I would love for you, Nicole, to share with the shifties a little bit about what burnout looks like for a nurse practitioner. It's a little unique for nurse practitioners. And while the symptoms and the framework or the basis of what burnout is kind of the same, but there's just different stressors for a nurse practitioner that contributes to burnout. I was wondering if you could share with the shifties what those unique stressors are, and then let's talk about what can we do to try to mitigate or reduce some of those stressors.
Yeah, I'd love to do that because I found, through my doctoral research too, researching burnout, it was an interesting time to be looking at burnout because of COVID. So we had a lot more information coming out about it, a lot more, more journal articles and things, not many that focused on NP burnout in particular, though. There's a lot about nursing, there's a lot about physicians, but we kind of were left in the lurch in terms of any meaningful research about that. And the little that's out there, I think, is really good. But also, 20 years as an NP has told me I know a little bit about burnout. I felt burned out at times. I've always loved my job, but I did find that there were these really unique things that the nurses were not experiencing, the physicians were not experiencing, but me and my colleagues were definitely feeling. One of the things, we can go through a couple, but one big one is that a lot of people don't understand what a nurse practitioner is. Any nurse practitioner will have been asked, probably fairly recently, like, oh, well, what is a nurse practitioner? Is that the same as an LPN? Or is that there's just a lot of misconceptions. You have patients that come in, some that, again, are not educated about what a nurse practitioner is and wonder why they're not seeing a physician. And, that definitely contributes to burnout when you're constantly justifying your experience and your education to patients, but also to health systems, private practice leadership. A lot of people are not, completely savvy on our scope and our education and our expertise. So just that, constantly re-educating people, it does get a little old sometimes. But it's also, I think, one of the most gratifying things when you have a patient that comes in and they're like, you could tell they're a little skeptical. They've always seen a physician. And then by the end of the visit, they're saying, oh, can you be my doctor? Can you be my nurse? I love that. Like, that is just one of the most gratifying things. We have talked about those misnomers, right? Like physician extenders or mid-level providers, which we are still referred to, in a lot of contexts.
And honestly, Nicole, that is such old school language.
It is.
We need to move on from that. Yes, I agree. I hear it all the time.
Yeah, exactly. Like, as nurse practitioners, we are not a physician extender. We are not extending the care of the physician. We have our own patients and our own plans of care and our own ideas. And, don't get me wrong, I have worked with phenomenal physicians who, a lot of them probably aren't even familiar with that term, and I personally have never felt that from the physicians that I work with. But I do know, working in a private practice and in a large health system, that a lot of times nurse practitioners are not used to their full capacity. And that's a shame. If people are not aware of the scope of practice that we're capable of, that not only hurts patients and the health system, but it definitely leads to nurse practitioners not feeling valued. And again, it's just not good for us in general.
Well, I think, and you have the patients, the relationship with the nurse practitioner and the physician.
Mm-hmm.
There's those pieces. There's not feeling valued. And then honestly, when, not if, when nurse practitioners are leveraged to their full scope, it impacts the bottom line in a very positive way.
Absolutely. Yeah, absolutely. And safety and quality. And, nurse practitioners have been shown time and time again to provide, quality care. So the more that they're doing, to your point, the more that impacts the bottom line in terms of finances and safety and quality and patient satisfaction and all the things.
Well, let me tell you, I had a really great experience over 30 years ago with a nurse practitioner at the Cleveland Clinic in Cleveland, Ohio. And I went to my annual wellness check and she said, anything bothering you? And she truly did a thorough head to toe assessment. And that was the last thing she said. Anything else bothering me? I was 29 at the time. And I said, actually, I have this really small, teeny tiny mole on my inner thigh. She said, let me take a look at it. And it's itchy. It's crazy itchy. She biopsied it. She called me, someone from the lab or somebody called me. It was 30 years ago. I can't remember. You have a melanoma. You need to get that taken out immediately. And I will never forget, that was like a shift in my mindset, a shift in my values, and a shift in how I appreciate the role of nurse practitioners. Had it not been for her and that thorough head to toe, because no one does a thorough head to toe like a nurse. That's how we're trained.
Right.
And she caught my skin cancer, and I had to have 35 stitches. They had to go in and remove it all.
Wow.
And I get checked every 6 months. And so I'm grateful for this nurse practitioner, the skill set, the great license that she has. She was a female, that makes care better, to your point.
Right. And imagine if, that nurse practitioner, instead of being allowed to practice in the way that she did, was stuck behind a desk, managing a physician's in basket, which is not
Right.
unrealistic. That is how a lot of nurse practitioners are utilized. They pick up a lot of administrative work that physicians don't have time to do. So it's really, I know we're going to get into solutions later, but it's really about being an advocate and educating people about what you can do.
Right. And I think we can use the shift medium right now to actually say to people that are aspiring to be a nurse practitioner, people that are considering it, people that are nurse practitioners, people that are on nurse practitioner boards and associations, we have to continue the work to advocate for nurse practitioners truly using their full scope so that we can serve society better, because that's why we all got into healthcare.
Exactly.
All right, now I'm getting on a soapbox. I don't want to go down that.
It's easy to do with this topic for sure.
Totally. I love it. So let's talk about another unique stressor that you've experienced, not necessarily you, but heard experienced.
Yeah, I think that another unique stressor for NPs is that when we see patients, nursing time and time again, year after year is, comes up as the most trusted profession in the United States. So I think when people are seeing a nurse practitioner, automatically it levels the playing field a bit for patients. They feel sometimes, I think, a little less intimidated, and that's great. That back and forth is what I live for as an NP. I love like I said, I love the detective work, and I'm a science nerd, so I love all the evidence-based practice and all of that. But it always amazes me that, patients come in and within minutes, they're telling you their life story. But the downside to that is, as much as that's, again, one of my favorite parts about being an NP, it can be very emotionally draining. And not to say that physicians don't get this as well, but again, I mean, it's in the research that people open up to nurses and nurse practitioners more than they tend to physicians. So that can take an emotional toll as well as we're absorbing all of this, the stories I've heard over the years, lots of trauma, lots of, really challenging health circumstances and life situations. And I love that people are able to open up, but you do absorb some of that. So I think, more than physicians, we might get, a little bit more of the stress from that.
And do you feel like because often nurse practitioners do the full head to toe, they're great listeners, they're all ears, it sometimes makes a 15 to 20-minute appointment 35 minutes, and then you start to get backed up in the day, and then nurse practitioners skip lunch, skip breaks. As you know, nurses, no one can hold themselves from going to the bathroom longer than a nurse.
Exactly.
And then that contributes to, if you think about Maslow's hierarchy, the basic needs, and then that starts to contribute. So what are some helpful tips, Nicole, that you can share with shifties that nurse practitioners, and actually any nurse for that matter, can build in a little bit of time during their busy day, whether it's clinical or non-clinical, to refresh for 5 minutes, 15 minutes?
Yeah.
What are some suggestions you have to offer? The Shift is brought to you by SE Healthcare. Do you know your current burnout level? Almost 70% of hospitals and healthcare systems can't answer this question. What we do know are the devastating results of burnout: increase in turnover, increase in medication errors and missed care, a decrease in the patient experience, and a decrease in quality outcomes. SE Healthcare can help with our evidence-based approach. Leaders can enhance nurse satisfaction and nurse engagement, improve quality care outcomes, and reduce burnout by 52%. Are you ready to uncover burnout's impact on your team? Visit us at sehealthcaresolutions.com/talk.
I mean, I have certainly been in that position where it's, my schedule, I had very little control over it. It was one patient after another. I mean, 15 minutes is just not enough when you're talking about, well, most visits, but particularly obstetrical care and pregnancy issues or complex gynecologic care. So the thing that I had to do was, number one, do my research. I had to look at other nurse practitioner schedules and say, is this just me, or is this, talk to other people, create a tribe of nurse practitioners, whether they are in your workplace or outside of your workplace or connecting online, and say, hey, like, what does your schedule look like every day? What are you expected to do? I can give you a personal anecdote that I worked for many years, being completely overextended, never having lunch, starting to burn out, taking my work home with me because there was no time for charting. And then I did exactly that. I started looking at other NPs templates within the health system. And it wasn't until I took that template, printed it out, and took it to my manager and said, hey, you know what? Other people aren't doing this. And this, I need a lunch break for my own personal well-being. I also need administrative time. I wasn't getting that. When I found that, again, I did my research, I saw other people were getting that. You have to advocate for yourself. And it's not complaining. To your point, I think a lot of us as nurses are, we enter in under that trial by fire, like the longer you work, the better you are. And, those double shifts, sure, I'll do them. And, not realizing that it might not be safe or healthy, and not creating those boundaries. So that was something that I had to learn over time, that creating boundaries doesn't make me weaker or less than. It actually makes me better. And right now, the schedule, the template that I have to see patients, I kind of inadvertently did my own little experiment. So here at Penn, we have something called a star card that we get a report every month of all the patient comments that come in, and then a rating based on, the survey that they're sent. When I was seeing more patients and felt overextended and burned out, my star card rating was less than it is right now. In 20 years as an NP, my star card rating now is at 5.0, perfect. And I know that that's because I have enough time. I can give patients enough attention. So not much changed with me, but the amount of time that I had and the way that I was practicing was much different. So advocate would be my most important advice to give people is do the research and then present and educate people. Again, a lot of managers, people that are making these templates during the day, they don't really understand what you do. So maybe walking them through too, like this is the visit, this is the care that I'm attempting to provide, and this is the time that I need allotted for that.
I love that. And I think often, Nicole, in my 30-year nursing career, sometimes nurses have a hard time advocating for ourselves. And I like to advocate, but I also call it being a master asker.
Mm-hmm.
And there's great value because if you don't ask, it's either going to be a yes or a no. So sometimes you have to put yourself out on a limb and ask, obviously ask in the right way. And I think along with advocating, I think you said this, I know you said this, boundaries. It is okay to say at 5:30 p.m., I am finished. I'm not going to take any more emails. I'm going to go spend time with my family, my friends, whoever you spend your time with. You've got to set these boundaries. And at the 2-hour mark of my day, I need to take 5 minutes. You can actually put this into your calendar. At 9:15, I'm taking one lap around the building that I work in. Take a deep breath, listen to the birds, whatever it is, but we've got to set in, and you can embed them in your calendar, make and establish boundaries and stick to it. That's the thing. We're not consistent with it.
Exactly.
And I don't know about you, but I get hangry. If I'm not eating every 2 hours, I am a hangry nurse. Nobody likes a hangry nurse. I can tell you that.
Exactly. Well, and again, I think it goes back to that misunderstanding of what we do. I know in many settings, when support staff needs help, nurse practitioners are often more approachable. So who are they going to go to? Oh, the nurse practitioner is definitely not as busy as the physician. And, they're always nice to me. So I'll go and ask them for this. So I think we absorb a lot of that too. And, another little tip that I found too is that I started leaving for lunch every day. Not sitting at my desk because inevitably somebody would come and find me, or that's just my own personality. I'm just going to answer this one. I'm just going to look at this one result. And then I went down the rabbit hole and I ended up working through lunch, which was not restorative then. And then I was right back at it. So just like you said, I would walk around the building. If it was raining, I would go outside. If not, I would just make sure, even if I sat in my car sometimes and ate lunch and listened to a podcast or just anything to turn my brain off. And it just made the biggest difference. I'm like, why did I wait so long to be, doing these things?
Well, you know what? It's interesting because I think we don't know that. I think in nursing, if we pick up that extra shift, it's a badge of honor. It's a badge of courage. And we have to stop that mindset. That's the shift of the mindset.
Mm-hmm. Yeah, for sure. For sure.
So Nicole, typically what we do is we wrap up the episode with a couple of nuggets or takeaways for all the shifties listening. Let's together collectively come up with some takeaways on how we can help the people that are listening set boundaries, advocate, all the good things that we want them to take away with. I'll let you go first and then I'll chime in.
I definitely think that advocating for ourselves and educating people about our education and scope of practice is vital. Until we do that, none of these other things are going to happen. We have to be working to the full scope of our education so that we feel valued and we utilize all of that hard work that we put into becoming an NP.
And the thing I want to add to that, Nicole, is in my experience, I've seen some organizations where they have directors of advanced practice nurses and PAs, and that helps because that role advocates for the nurse practitioner, and The other thing is I've seen shared governance or professional governance councils that are strictly nurse practitioners, which has aligned to the chief nursing officer. That's been helpful. I've seen organizations where they really focus on nominating nurse practitioners for the Daisy Award. There's a lot of different ways that we can advocate and promote the role of the nurse practitioner.
I agree. And I think that, acting locally and larger is really important because at Penn, we have an APP director, which is really wonderful, but
Yes.
also our organization is really large. So one person can't possibly know what's going on in every single practice. So, advocating and educating is important, but getting to, that APP director with any concerns, but also, your local leadership is important as well.
It's so helpful to have that role. And we can talk about boundaries. I think boundaries are a great takeaway. Again, one thing that I would like to add is when you have a busy schedule, whether it's seeing patients or you're in a leadership or administrative role, at the beginning of the day, take a minute, review your calendar, and identify which of these meetings can I maybe delegate to someone else. A true HRO or a high reliability organization defers to the expert. As a leader, it's okay to say, you know what? Let me have someone else attend this meeting. They might be the expert anyway, and they can come back and report to you. In reviewing your calendar, you can also find times that you then have to put in your calendar. Here's a 20-minute break, or here's a 20-minute lapse. I'm going to go get something to drink. So we, as leaders, need to own, as nurses, need to own our own time.
Absolutely.
We're in control of that. So that's a takeaway that I have.
Yeah, and not feeling bad about it. Saying that this actually makes me better. It doesn't make me lesser to just, to take that time for myself. It actually makes me more effective and better at what I do.
I love that you say that. It makes you better. If you had one thing that you could say to aspiring nurse practitioners, what would it be?
I mean, I think it goes back to advocating for yourself. Really, I think that's the most important is, when you're new, it's hard to, find your footing and find what works for you, but speak up. Don't suffer in silence and find colleagues, find a tribe, find other people that, are nurse practitioners that are experiencing the same thing as you, because it's very validating to, call someone up that's in that same situation and say, hey, are you experiencing this too? Because I think we doubt ourselves a lot. So having that support system is really vital. And if you don't work with another NP, find someone in your organization or somebody you went to school with, something like that.
I think that's a really great point. I think we need to have a tribe. I love when you say we need to have a tribe. That's great. We need peer support now more than ever. And I know sometimes nurse practitioners, if they're the only nurse practitioner in the practice, it's like you're the Lone Ranger, and we're not Lone Rangers. So that's a great point, Nicole.
Absolutely. Absolutely. And as a new NP, think about that when you're looking for a position. It might not be the time in your life to be the sole nurse practitioner. That is something that in my first NP job, I had 5 other NPs that I worked with. And looking back, at the time, I didn't even recognize how important that was. But looking back, I think I would not have been successful in that role had I not had that support system. Later on, then I was the sole NP. I'm, the sole NP now in this practice, but it just doesn't, it's not a good fit to go into it like that. You really need that support. So make that something that you look for when you are trying to get that first position.
That's a huge takeaway. Nicole, I can't thank you enough. Your friendship, your knowledge, everything that you share is just so inspiring to me. So I want to thank you for all your great work at UPenn, or let me start that over. I want to thank you for all your great work at UPenn, and just really thank you for being partners with me in this profession that I know we both love so much. In the future, we'd love to have you come back and be a guest. Is that something you'd like to do?
I would love to do that. There's so much more to dig into. So Yeah,
Totally.
absolutely.
There's a lot more to talk about. So thanks again. And shifties, as a reminder, your shift makes the difference. Enjoying the shift? Help us reach more nurse leaders by rating and reviewing us on your podcast app. It takes just a minute, but makes a big impact. Search for The Shift, tap those stars, and share what you love. Your feedback shapes our future episodes and helps others discover us. Remember, rate, review, and amplify the shift today.